Steve Mansfield, if that's you and the attendees, raise your hand so I can promote you in here. Yep, that's you. Okay. There you go. Hi, Steve.
Hey, everybody. How are you?
Great. How are you?
Hanging in there.
Danielle, you are muted, but you're trying to figure out how to share it on your page. So let me see if I'm able to do anything there. You can share it from my page, I think. Okay. Cool. Just going to give Danielle a minute to get all squared away and allow people a couple more minutes just to pop on before we get started. We have a little bit of a turnout, so I'm excited about that for this important update. So that's good news. You all set, Danielle?
I think so.
Okay, good.
Give me just 1 second. I'll be right back.
Yeah, that's fine.
Here, Kim.
All right. So I think we've got this shared in a lot of spots right now, and so folks can certainly join us, whether they decided to join on the call via Zoom, watching us on Facebook, and I was going to see if I could record it, which I will. So that way we'll also post this to YouTube tomorrow for those who are not on social media. I'll just quickly introduce, I'm Mike Urgo. I'm the first selectman in North Stonington. Very pleased and honored to be joined by Danielle Chesebrough, first selectwoman from Stonington, and Director of Health Steve Mansfield for Ledgelight Health District. The purpose of this evening's webinar is to really give a brief update of where things are at as it relates to the COVID-19 situation, and really just to be able to answer questions from folks. So how we'll handle it is Steve will have the floor. We figure 15 or so minutes or however long he needs to give some really crucial updates from Ledgelight, and then Danielle and then myself will shortly just give some brief town updates, and then just really open up the questions for the floor for questions and answers on things. For those who are joining us via the Zoom, you are able to just raise your hand in order if you have a question after the presentations are over. If you're on the phone, you just hit *6 or to unmute yourself when that time comes. And then finally, I'll keep an eye on the Town of North Stonington Facebook page. I'm sure Danielle will do the same for Stonington. If there's anyone who wants to comment on there with questions, we could try to do our best to see those to answer any questions you might have. So I think that covers everything to get us going, unless I've forgotten anything. And if I'm seeing that I haven't, I would love to open up the floor to Steve Mansfield. I know he's very busy and very thankful that he took some time to join us today. So Steve, the floor is yours.
Thanks, Mike. Hi, everyone. It is crazy busy. That's the only way to put it. While I was preparing for this event tonight, just answering call after call after call from our contact tracers, and it's really all related to the spike in cases we're seeing in southeastern Connecticut. It's not wholly unexpected, to have another surge in the fall, but what we're seeing isn't really what we expected in terms of where the cases are appearing and the amount of effort it takes for not only Ledgelight Health District, but our municipalities and our school systems, and a lot of our community partners to respond. So First, I just want to go over the data real quick. I just looked at it a few minutes ago. As of last Friday, we have 1,386 confirmed cases district-wide. Thankfully, in North Stonington, we only have 17 cases as of last Friday and 56 in Stonington. This week, we've had an additional 2 new cases in North Stonington and 4 in Stonington. So both North Stonington and Stonington, along with Old Lyme and Lyme, are I'd say the most unaffected in our communities as far as the raw number of cases. But there are absolutely a lot of what we call clusters in all of our towns, which I think I'll take a little bit of time just to explain what happens when we get notified of cases and how it can quickly go from just a notification and a simple contact tracing to something that is pretty extensive and involves not just the health department, sometimes the state health department, our school systems, and so forth. So right now, what we're experiencing that we really didn't expect are community-based infections. Although we have cases in schools, we have cases in restaurants, we have cases in other institutions, long-term care facilities. There aren't that many, and we're not seeing a lot of person-to-person transmission in those specific areas. What we're seeing are families and groups of people getting together. And I'll tell you how we find that out. When our contact tracers go out into the community, we make contact with the ill individual and we ask them a series of questions. And through those questions, we find connections. So frequently we'll find one event that numerous people in our jurisdiction, sometimes from many different towns, have all attended. So that can be termed a super spreader event if we have that many people. Unfortunately, those are the hardest types of events to control. Schools are relatively easy because they're structured environments. You can put in place mechanisms to prevent person-to-person transmission. And so far, those mechanisms in most of our school systems are working really, really well. I think New London is one of the best examples. Although they have one of the highest rates of infection per 100,000 people in the state at the moment, the cases they're seeing in their schools is really low. So we attribute that to all of the planning that they've done, all of the mitigation measures they've put in place. They're working so far. I'll also say that's probably one of the most contentious subjects. People frequently call me at the health department and say, why aren't we doing more for the students? Why aren't we going to a full remote model? And my reply is, we are absolutely concerned with the students and the personnel who attend these schools. But in fact, in some of our communities, it's safer for the children to be in the school system because it's structured, because there isn't a lot of transmission in the schools. And I'll go a little further. As some of you probably know, there's a series of addendums associated with the Department of Education. And it says if you have a specific case rate in the county, then you should consider moving to a certain model or staying in a certain model. That's really important to recognize because, for instance, in New London, and I'm using that as an example because they have such a high number of cases, even though the case rate in New London is high, the state is still recommending that we look at county numbers because those local numbers are relatively unstable. They're so small. So from an epidemiological perspective, whenever you have a small sample size, it's very difficult to make or come to conclusions about it. So making large policy decisions based on a very small, relatively small number of cases and data is never a good idea in biostatistics and epidemiology. So currently they're looking at only the regional numbers. And that's not just for school systems, it's for a lot of decision making. We understand that DPH may be changing that metric soon and begin to look specifically at the data at the local level, which I think will be a game changer for everyone because it will really inform a community about specifically what they should be doing in their community. You know, maybe moving to a full remote model or moving from a full in-person model to a hybrid model or something like that. But the way they're justifying that, so to speak, is they're looking at a longer period of time. So not to get too far into the epi of it, but if you're only looking at a week's worth of data and a small number of cases, you don't really get a good picture. But if you stretch that out to 2 weeks, you get essentially double the number of cases and it becomes more statistically significant. So We expect that to happen soon. It was supposed to happen early this week, and hopefully it'll happen before the end of the workday tomorrow, so we can all move forward with that that metric, so to speak. So another thing I wanted to mention, I'm sure people are aware or read in the newspaper, everyone moved to phase 3 in the DECD guidance from phase 2 on October 8th. That happened statewide. And Governor Lamont decided that certain municipalities, I believe there were 4 in the state of Connecticut, New London being one, he actually gave the authority to the mayor in the city of New London to determine whether or not he wanted to stay in phase 3 or revert to phase 2. To make a long story short, I wrote a letter to the mayor and told him that the difference between phase 2 and phase 3 is pretty minimal, and it really addresses the capacity limits. So currently 50%, not currently, with phase 2 currently, compared to currently, the difference is only 25%. So it was 50% occupancy during phase 2. It goes up to 75% occupancy in phase 3. The reason why I was supportive of staying in phase 3 and not reverting to phase 2 is, as I mentioned earlier, that's not where we're seeing the cases. We're not seeing cases associated with institutions and so forth. So it doesn't make a lot of sense to put an intervention in place for such a small geographical area when the data shows us that's not where we're seeing the disease transmission. We weren't sure what exactly was going to happen with those other communities, but I know at least Norwich chose to make the same decision, and they're going to remain in phase 3, which I think is a good decision now. So what does that do for us? It allows us as a district to focus on those areas throughout our jurisdiction where we need to focus. We're dumping the most amount of resources now into contact tracing, which is huge. It's really a 24/7 job, and our contact tracers are always on call, always answering the phone, and always crunching that data. But looking at what our contact tracers are finding in our communities, and then addressing those issues specifically. Our whole goal is to reduce the amount of transmission of COVID-19. The second thing we're doing, and Mike, you can speak to this a little bit, I'm sure, we're setting up testing sites all over our jurisdiction. Just over the last Thursday, Friday, Saturday, Sunday, call it a 4-day weekend, we tested more than 1,000 people in our jurisdiction with our community partners. And that's so critical because what that does, it identifies people in our community who are asymptomatic, possibly asymptomatic and walking around and infecting people. So once they determine, or the test determines that they're positive, then we can tell them the appropriate measures to take, isolation for them and quarantine for their close contacts. So ideally that removes that person and immediate the surrounding people from our community and lessens the likelihood of disease transmission. So it's critical, and we're encouraging everyone, symptomatic, asymptomatic, whether or not you've been tested before, to go to any of our clinics, and they're all listed on our website. And they're free and they're walk up. And it's much easier than it was in the beginning. I've had the test at the very beginning of the epidemic, which was, I'll say, pretty invasive, very deep into the nostril, nothing short of painful. It's much different now. It's very shallow. Takes a little bit more time to do the actual swabbing, but it's really, it's not even a little bit uncomfortable. So we encourage everyone to do that. The more folks we can get in all of our communities to be tested, the better everyone will be overall. I mentioned contact tracing and how much time it's taking. And just so you have an idea of what we're actually seeing in our communities, we're seeing contact tracing identifying sports, gymnastics clubs, dance groups, those venues where large groups of people are getting together. Even if they're wearing a mask, they're in close contact. We've actually made recommendations, and they've been heeded, to shut down a very large hockey league because there are so many cases. And we made the decision, both Patrick McCormick at Uncas Health District and myself, that we didn't have the resources and the ability to do adequate contact tracing to assure that we could interrupt that pattern of disease transmission. So a 2-week suspension of all league activities, practice, games, any type of interaction related to the people who usually attend that, a 2-week hiatus will basically stop the disease transmission. Now, of course, that's not ideal. We don't want to be as restrictive as that, but it's our job to protect the public health. So if we think that's the best thing to do, that's our recommendation. So we've done that with a couple of different high contact sports, football, a volleyball team had to suspend activities because so many people were infected. So I think we're seeing the tip of the iceberg now. I think it's going to become more and more common to see large groups of people spreading the virus, and then rather than being reactive, being proactive. In one of our municipalities now, it's the first time that it's happened, but we recommended a closure for a number of days because of a number of cases in that school system. And we also recommended they suspend all sports activities, extracurricular activities, anything associated with school. If we're going to say the school needs to be closed to stop that person-to-person transmission, it only makes sense from an epidemiological perspective to also suspend those activities that we see as being the primary activities that are spreading COVID. So as you can imagine, that's not well received by everyone, but I think it's one of the most important things that we can do to lessen the spread and the transmission person to person. I think I've covered the majority of topics I wanted to cover. I think one of the most important things we can do is answer questions from people because we definitely can't think of anything. So I'll open up the floor or whatever you have on the agenda, Mike. Thanks.
Thanks, Steve. I just wanted to give Danielle a chance to mention, as we're co-hosting this, anything regarding Stonington that you'd like to throw out there, and then I'll give just a quick update on North Stonington and then open it up. So.
Yeah, no, really briefly. I mean, first, just a thank you to you, Mike, for organizing this again. We did one at the start of the pandemic and seemed timely to do it again. And a huge thank you to Stephen Mansfield and everyone at Ledgelight. I mean, we couldn't ask for better partners in this. You guys have gone above and beyond every day. So thank you. I think our only updates I wanted to share, because I do think we want to keep most time for Q&A, is just to let people know who might be watching. We are doing weekly updates on our website every Friday after we get updates from Ledgelight and from the state. We try and update that with statistics as well as any relevant town news. So I do encourage people to check that out. We'll do our third weekly one tomorrow. Also, just on testing, since Stephen mentioned it, we have had a lot of people come out to our free testing at a mobile site behind Human Services, anywhere from 200 to 300 plus people every Friday that we've been offering it. It is being offered again this Friday, as well as next Friday. So we hope people continue to come out. I can vouch for what Steve said. I went last Friday for the first time to get tested, and I was nervous, but it wasn't bad. And I'm going to try and go again tomorrow. People can go without appointments, or you can make an appointment and then circumvent the line. The only other thing I want to bring up is we have been trying to do a focus on mental health, recognizing the physical health impacts of this is obviously a key component, but so is the mental health. We've been getting a bit alarmed, I think, as most people are, just different surveys and statistics we've seen with increase in suicide attempts, calls to centers and resources. Also, our local domestic violence nonprofit in New London seeing a huge increase and a huge increase in need. I think recently they said they've seen an 830% increase in cost since the summer. So I think we just really want to be focused on that as a community, support each other. At our Human Services, we have free counseling. I think a lot of people in the community don't know about. People of any ages, kids all the way to seniors, can come. Free counseling. It's offered virtual or in person. We have outdoor and indoor options for people, as well as we can do grocery deliveries, book drop-offs, also just check-ins. Again, they could be virtual or in-person check-ins, just to be sure people are doing okay. And just to people on the line, whether you're in Stonington, North Stonington, or otherwise, if you have ideas on more we can be doing as a town or as a region on the mental health component or on issues of domestic violence, please do reach out to us. We are constantly getting new ideas from other communities and trying to replicate some best practices we see. So with that, I'll yield the time for any questions. Thanks, guys.
Thank you, Danielle. And I'll just, I don't have too much else to add except we're also, heeding Ledgelight's guidance as it relates to things. And, we've been fortunate. We did do soccer this year, and we're following the protocols required for that with regards to the town. And actually, I think we just sent out another email as a reminder to some folks, because as Steve mentioned, we're hoping to be able to continue these things as it safely can be done. And I think as much as we're following the protocols and doing all the right things, that we're going to be able to continue to have things that we're happy to have through this very difficult time. Steve mentioned about the testing sites, and Danielle mentioned there's one in Stonington that's happening. I've actually been in contact with Ledgelight a while back, but now with the uptick in New London County, we are looking to have a testing site set up here in North Stonington. So there'll be some information to come shortly on that as well. So folks will be able to get tested right here in North Stonington. And then, we've kind of changed out the signs coming into town a couple of times. We're trying to keep people aware of the masks are the best thing we can do right now. And I was watching, just 60 Minutes on Sunday, and all of these people who are experts are saying, that's the best thing. I mean, yes, a vaccine hopefully is going to be around the corner, but really the masks are the protection that we need. So, when you're in those situations where you can't keep distance, whether it's with family or wherever it might be, consider putting those masks on, because it just make all the difference. And although this virus is not necessarily deadly for the majority of people, it is for some, and so we have to be cognizant of that. With that, I would like to open up the floor for questions, and I have a couple that are written so far. So before we go to the phone attendees or the web attendees, I've got a question here. It says the numbers today look like we crossed that greater than 25 per 100,000 for New London County, in parentheses 26.5. From what you said, I think she's talking about you, Steve. There is a new guideline being released tomorrow that may change. What would have moved us to distance learning? Does that make sense to you, Steve?
It does. It does, except for the number. So I'll say that we utilize a specific website to look at the county level data, cases per 100,000. I'm happy to share that website with you. It's part of ct.gov, and the current numbers for New London County COVID rates per 100,000 people over a 7-day period is 19.7. So the data I have doesn't put us over that 25 mark. And I'm happy to share that data source, and I'm not sure where the data source of the person who wrote the question is. I'm looking at it live as we speak. It's the latest. It's not up to date today. It's the latest that's been posted on the website. So that absolutely may change as soon as they calculate it. And if that goes into the metric and it's over 25 for a county, that absolutely could change things, as the writer of the question indicated. One thing I want to make sure everyone understands is those metrics are there as a guideline. They don't necessarily, they're not necessarily the only thing we look at when we consider whether or not a school system is going to move from a hybrid model to a full remote model. And I want to be clear, it's not my decision. It's the decision of the superintendent in those respective municipalities. Of course, they reach out to us from a public health perspective and say, what is your recommendation? So we look at those metrics very closely and make the determination of where they fall according to Addendum 4 of the state document. But we also consider, as I mentioned before, what we're seeing in the community. So if we're seeing very low rates of transmission in our school system, despite what the rates are at the regional level, at the county level, then we may say, yes, the metric says we should consider moving into a full remote model now. But what we're seeing in real time, the data doesn't support the metric. So I'm more concerned with looking at what we're seeing in our communities and what we project to see in our communities, in those school communities, when making that decision. So we absolutely don't discount the metrics, and they're developed for a very specific reason, but they are recommendations, and there are school systems that look at the county level data and say, okay, based on the county level data, it says we should consider a hybrid model, but based on what they're seeing in their local communities, they decide to go to a full in-person model. So they are definitely recommendations. I just wanted to make that clear.
Thanks, Steve. And she responded back, it was COVID Act Now, I guess is the
Right.
site.
I'm familiar with COVID Act Now. It's a great website. It's really good, but it's not the official website. It's not the numbers that we use in the state of Connecticut. We're required to go to ct.gov to the website to get those actual numbers in our communities. And as I mentioned, they're probably going to be moving toward a 2-week average and base it on the town level data rather than the county level data. But I don't think it's premature to say that. I haven't seen the documents yet, but that's where we're going to be moving.
Thank you, Steve. I have another couple questions. One of them was what website has a list of the testing sites, and that is www.LLHD.org. So that's where Ledgelight, our more local testing sites are listed on there. Question here, on average, what amount of time might transpire between when someone is exposed and when they are notified of this exposure by contact tracers? In other words, what is the window of time during which someone could be unknowingly infectious?
So generally, that's 2 weeks, and I'll explain a little bit. So if, let's say I began experiencing symptoms, and my wife wanted to know if she was also positive for COVID, it may take up to 2 weeks before a test would show whether or not she was actually positive. And that's really important to remember because one of the most common questions we get, and we get it almost every time we contact a close contact, is, can I get a test? And if I get a negative test, does that mean I don't have to quarantine for 2 days? And the answer is no. If you are identified as a close contact, the 14-day quarantine period is mandatory, and a test does not supplant the requirement for quarantine. So, and that's going right back to the question. The reason behind that is you may test negative, day after day after day, when in fact the virus is in your body. It just isn't visible, so to speak, in your blood yet. So about 2 weeks is the outer limit for when you will test positive if you're actually infected.
Thank you, Steve. Danielle, did you have any questions on your end that were popping up? No? Okay. Hang on, I've got a response back on your question, answer, Steve. Let me clarify my question. If I have a positive child in my class, so it's teacher, on Monday, how many days would I continue teaching other cohorts of children before I am aware of the need to test and/or quarantine?
Good question. And we get that question every day. So if we're notified of a positive case in the North Stonington school system, the day that we're notified, we make contact with the case, and depending on the age, we may limit our contact to that case and perhaps the teacher in that particular classroom. The person is considered the best health historian of record. So we absolutely don't go to a school system and start interviewing everyone and say, did you come in contact with Steve Mansfield? Number one, it's impractical. It's just impossible to do. Number two, we have an issue with confidentiality. So we have to only share data with those individuals that we need to share data with in order to do our epidemiological investigation, that contact tracing. So to answer the person who asked the question, if you're a teacher and one of your students tests positive, we'll be in contact with the student if they're old enough to answer our questions, and obviously their parent as well, to get a list of close contacts. And usually it's the same day we'll reach out to all of those close contacts. And we have a script, and it says very clearly that you've been identified as a close contact of someone with COVID-19, and here's what you need to do. We don't provide details, personal information, and so forth. It's confidential, and that sometimes causes issues. People want to know where they're exposed, when they're exposed. But from a public health standpoint, it doesn't do any good to share that information as long as people are doing what they're asked to do as far as quarantine. So it generally happens within a 24-hour period. Caveat there is nothing is absolute in public health. There are certain days where we are so overwhelmed with an outbreak that's big enough that it's an immediate and substantial risk to the people in that community. We have to direct our resources there. So There are days where it may take longer than that. But when we do get overwhelmed, and we do at the local level, there is a cadre of state contact tracers, and we can, with a flip of a switch, turn over all those contact tracing activities in our community to DPH. They're actually graduate students, and they work at Yale, and they're hired by DPH to do that work. We don't turn over any of the contact tracing activities that are associated with schools. It's just to, you need that local partnership. You need that local knowledge in order to do everything we need to do in school systems. So we handle all of the school-based infections, and we work with the school to do the contact tracing. And that's an important thing to note. Although we have, in school-based settings, we have the communication with the infected individual. It's the school's responsibility. Once we give them the list of all the people who are close contacts, they actually do the shoe leather work, so to speak. They do the contacts of all the people in their community, in the school community, who need to be quarantined.
I think it's a good question and a good point too, because as we're seeing more cases in some communities, luckily, as you said, North Stonington and Stonington, although we have cases, it hasn't been as dramatic as some other areas. There's a, if you are in a, say you work somewhere that someone has been, tested positive, I think there's an immediate reaction that, oh goodness, I have to go get tested, and the reality of it is that, you will be contacted by a contact tracer. And if you haven't had that contact with the person, it's not that a dramatic thing necessarily. So the litmus test is the 6 feet or less for 15 minutes or more with an individual that you would be considered somebody who would probably need to quarantine at that point. But if you've just passed somebody in a hallway and you're wearing masks, this isn't something where you would need to be necessarily concerned, or you wouldn't be contacted by a contact tracer. Is that pretty accurate, Steve?
Yeah, absolutely. I did just see Helen's question, and I absolutely understand what she's saying about people not knowing what they had for breakfast or dinner yesterday. I'm one of those people. It's actually one of the most common responses when we reach out to do contact tracing. And I've gotten involved after hours when we're overwhelmed. And one of the first things they say is, I can't remember what I had for dinner last night. So it is always difficult to get accurate information. And I'll just clarify what I said. There are absolutely high school students that we've worked with who are really good historians, and they can list everyone that they came in contact with and so forth. And there are other situations where we absolutely reach out to the instructor or the teacher or the coach or whoever it happens to be who was in charge of that particular group. So we don't have any concerns sharing confidential information when it is justified to do our epidemiological investigation. We just limit the amount of people we talk to because every person you talk to is a potential break in that confidentiality chain.
I think, and there was just a follow-up, the 6 feet or less for 15 minutes or more, that rule does apply even if people are masked. So, even if you're somebody who's masked and you've been in that close of proximity for that amount of time with somebody for 6 feet or less, then yes, that you still would be asked to quarantine as part of the contact tracing. I know, if I think about my own routines, and everyone's is different, I guess, during this time, but I mean, I can remember if I were in proximity with somebody for that amount of time, because especially now, I think I'm just much more aware of it. And I think as the cases rise, unfortunately, we'll probably all need to be much more aware of, who we're actually exposing ourselves to. Obviously, our families are going to be, definitely, but, hopefully we're keeping those close contacts to a minimum, and those, going remote as much as possible with regards to, meetings and stuff like that we can. But so we haven't had any questions yet come through on the phone or on the Zoom. If you wanted to, all you have to do is raise your hand. I do have a hand raised. And if you are on the phone, you just need to *6 to unmute. But I do have Ed, who's asking a question here. Ed, you are able to unmute yourself. Go ahead.
Okay, do you hear me?
Yes, we do.
Yes, my wife has a question. Yeah, what is the difference between quarantine and isolation? How do those differentiate? And what do you do under each one of those situations?
That's a great question. And I will say there are a lot of people who have much higher pay grade than I am that use those interchangeably, but they are actually much different, and it's relatively simple. Quarantine means you've been exposed to an infected individual and you need to take protective measures like staying at home for 14 days, not coming in contact with anyone outside your family, where isolation is only for people who are ill. And the rules are different for isolation. Isolation is 10 days from the time of a test or the date of symptoms. So isolation is for sick people and quarantine is for people who have been exposed to sick people.
So if you're in isolation at home, you should stay away from family members in your home as well.
As much as possible. And we realize that's difficult to do. I have a number of friends who have been COVID positive and they've holed up in their bedroom, and the only contact they have with their family, they were lucky enough to have a bathroom attached to their bedroom, is when someone dropped off food for them for that 10-day period. One of the biggest things we see, I do what are called PSAP notifications to our first responders, usually every morning before we even go to work. What we're seeing is, an address and then 2, 3, sometimes 4 people in the same household getting sick. Generally, when you have one, and we've seen this throughout the pandemic, you see another one within a couple days and another one a couple days later, and it's not unusual at all for the whole household to become ill. But we also have situations where one individual has been ill and no one else in a family of 5 has gotten COVID. So yes, isolation means stay away from everyone, all human beings, as much as physically possible.
Okay. Thank you.
Thank you.
Sure.
Thank you. Danielle, did you have any questions on your side?
Yeah, we had one question. I think probably, sorry to keep asking Stephen, but it'd probably be best for you. It was really about, as people are looking to still have some sort of social interactions with friends or family, do you have any advice or guidance for them in terms of how to have some social interactions while also limiting kind of the spread and thinking about contact tracers and what they have to do when these social interactions happen?
Sure. And it sounds really simple, and I've said it before, it's not simple to do. We understand that limiting social interactions is really difficult. I'll use my personal situation. My wife and I went for a mountain bike ride right after work before this. And of course, I mentioned public health things to her wherever we go. And I said, look at that group of people over there at Haley Farm. And there was a large group, probably 15 or more, of obviously unrelated people drinking wine at a picnic table under a tree. And that's a situation that's ripe for transmission. And as I said, that's the most difficult kind of situation to get people to stop participating in, because that's what people like to do. People love that social interaction. The most important thing to do is to have your family circle, or whatever your social circle is, should be as small as possible. Ideally, you don't come in close contact with anyone other than your family and the people that you have to come in contact with at work. At my workplace, we have 23 individuals. I would say if I tested positive for COVID today, I would have no close contacts. But we're a health department, so we're all very vigilant. We don't take our masks off. We don't gather. We don't have in-person meetings. I won't even speak to the press face-to-face unless, of course, the governor called this weekend and asked me to speak, so I had to. But generally, we're very rigid about that. The less rigid you become, the more your risk of infection goes up. And obviously, in certain geographical areas and certain situations, it goes up quicker than others. You're safer outdoors generally than you are indoors. So whenever you put yourself in contact with people outside of your immediate family circle, or even close group of maybe family members who don't live in your house, the larger that circle gets, the more the risk is of infection. So the less you can interact with people outside the group, the less the risk.
Thanks, Steve. We do have a question. Margaret, you are recognized. You just have to unmute.
Unmute. Hi, how's it going?
Hey.
Hi there, how are you?
Okay, great. So my question is related to the, it looks like in a new update on iPhone, you are able to choose COVID-19 exposure notifications, and it's under just settings exposure notifications, except it has to be, let's see, it says your public health authorities guidelines determine if an exposure is significant enough to notify you and provide next steps. However, it's not available in our area. And I was wondering if that was something that you were familiar with. It actually told me it wasn't available in the area just when I selected the state of Connecticut. So I wasn't sure who was in charge of that and if that seemed to be something that would be rolling out, as I would love to opt into that.
It's a great question, and someone by the name of Kristen Whipple on the chat asked a similar question. Do you know if the state of Connecticut plans to use or activate the exposure notifications available on cell phones? I haven't heard any discussion of it at all. A few months ago, I heard some talk of that, but the discussion just went away. So I'm not aware of any discussions happening. I wouldn't be surprised if they may be in the works behind closed doors at the governor's office or DPH, and they'll roll that out sometime in the future, but haven't heard any discussions of it at all. I think, in my opinion, it would really be based on need. Right now, Ledgelight Health District is able to stay on top of our contact tracing efforts with the assistance of the state health department and that cadre of volunteers, but it absolutely could reach a point where, as I said to the other person earlier who asked that question, our 24-hour turnaround time to get back to people and be in contact with them, that may change. There is only so much we all can do, and when we get overwhelmed, we need to rely on external resources as much as we can, and we're not afraid to ask the state of Connecticut and DPH for help when we need to. But something like that notification system, if it's accurate and people utilize it, and it's in languages that serve all of our communities, then I think it would be a useful tool. But no, I haven't heard anything about that being implemented in Connecticut yet.
Okay, thank you so much.
Sure.
It's something that could possibly be asked. We have a bi-weekly call with the governor's office. They've been very, very helpful to all the municipalities and the cities, and really we're able to ask questions directly to the governor's office regularly and have contacts, and it's been very helpful. So maybe something we could ask them about. So
one thing to add on that, Mike, is I think it's really important to recognize that when we saw that spike in New London, one of the first things the commissioner, our new acting commissioner at DPH, did was reach out to me personally and say, she got right to the chase. She said, "What do you need from us?" So we told her exactly what we needed, and one of the things was it was just a bit of red tape. We're getting a significant amount of money from the federal government that's been funneled through the Department of Public Health, and we put in our application. And it was just taking a long time to get the approval, to get the money. So I said very clearly, we need our application approved and we need our money. And literally within 3 days, we had our check at Ledgelight Health District, the first installment on $860,000. And that's good because we've already hired personnel based on that money coming down the pike. So she said, "What else do you need?" And we needed assistance with our testing program. We needed assistance with translation services. So everything we asked for, DPH has been really quick to respond and really, really accessible. So it's great to have that, I'll say, a renewed partnership with the Department of Public Health. They want to do everything they can to assist us, especially those communities that are hard hit, like New London at the moment.
Thanks, Steve. So I have Margaret. Did you have a follow-up? Your hand is raised. I don't know if you meant it today.
Oh, no, I'll lower it. I'm good. Thank you so much.
You're welcome. Thanks. Let's see. Nita Kincaid. First, Selectwoman Nita Kincaid. Happy to be joined. You just have to unmute, Nita. Yeah. There you
Hi,
go.
Anita, how are you?
Hi, how are you?
Good.
Nice to see you.
You too.
I have a few questions here, and we actually had, as you know, Mike, talked about this at our last meeting on Tuesday. First of all, with the tests in this area, are they all the same kinds of tests? When I watch it on TV, there are quite a number of different tests. Some take longer times. And I have talked to quite a few people who have been very stressed about going to get a test in other places around here, like in Westerly or something like that. And they didn't know they were going to have to wait 10 days. And I assume that this is more coming together now. Is that true or not?
It is true. So all of the testing sites, they're not all manned by the same people. We contract with external testing services, and they're really good. It's changed dramatically. They give us an outside number of 72 hours, so 3 days from the date you get swabbed. But generally results are coming back in 1 to 2 days. So it is a quick turnaround. And we also, not only the turnaround for the patients, but we get data on positivity for all those people who get tested, not quite in real time, but usually same day. So it takes a while them to process everything and get the notifications out to the folks. But it's really good because we can see the positivity rates in our community and decide, do we really need to saturate this particular community or even neighborhood with more testing? So yeah, it's much quicker and much easier. And the swabs are much more palatable. As I said earlier, it's really a painless situation. And I should note they're all free. All the ones that we promote, all the ones that are listed on our website, they're available to anyone from any jurisdiction. You walk up or drive up and get tested.
Okay, and so I guess I'm asking the whole team up there, do we want to reach out to certain groups initially that, you know, like the teachers, have all the teachers had tests, have the people who work in town hall or are often always in town hall? Should we ask, you know, just nicely say, we have this now, please take advantage of it if you have any concerns? Or should we wait until they do something? And I guess I'm asking that to all three of you.
Mike, I'll take a first stab. So Mike Urgo and Jennifer Muggio, my Deputy Director of Health, have been in conversation. I've been CC'd on all the conversations regarding standing up a testing site in North Stonington. Mike, is that solidified yet? I haven't seen the final details.
We haven't solidified a date yet, but it will be coming in the short term. And yeah, we're probably going to do it at the school on a day that there isn't any school there, outside, of course. So there's a lot of parking, not just parking, but traffic available so that we don't back up onto Lake Route 2 or something like that. So yeah. More to come within the next day or two, but yeah.
Yeah, and Nita, we've done that enough times, as you're probably aware, during H1N1 11 years ago. That's where we really started our mass vaccination program. And we've had drive-through clinics at least a couple a year since then. So they're really routine at this point in time. We know how to go out, set up cones. We did it in New London on 2 hours notice. We were testing people. So it happens really quickly. Establishing those traffic patterns is old hat for us. Really pretty easy to do. And we have a great group of staff at Ledgelight and our Medical Reserve Corps volunteers, and of course, all of our other community partners who participate and jump in. So yeah, I agree with you, Nita. I think, you know, focusing on town personnel, teachers and so forth, and encouraging them, because it's so quick and easy to do, it's a great idea. And that's what we've done in our other communities as well.
Okay.
And they have been, Anita, I know, like, some that don't want to travel far, you know, thankful to Stonington, they were able to get a site up. And I know there's people in North Stonington who've been able to take advantage of that site so far as well. So yeah, more to come, you know, for us more locally, but we certainly will encourage people, as Steve said on the call. And I don't know if Danielle, you have anything you want to add to that?
Say, in case it's useful for anybody listening, or for Mike, we've been using the Everbridge, our reverse 911 system, to share the testing dates, and that's been really successful. I'm sure some people are getting tired of getting them, so apologies. But we talked with Mike Caplet, our contact for the region of the state, And they've been encouraging all municipalities who have it or to use the state system. And I think it's really helped to get the word out and get it to the more people than we would just through our normal communication channels.
See, I think there are very many people who would like to know whether they're okay or not okay, but they've heard so many stories, they almost want to back up and not take a chance on things at all. So I think if we did a good job with this, it would really be useful for the town, because we do have a lot of older people who don't even come out very much. We could even do, I don't know what it's going to be like if there would be something that like the would be going out in a truck at some point in time around town or something where people, Mike, aren't living by themselves. Just a thought, but I think we could do some really good things with it. That's all.
It's a great idea, Nita. Thank you. Did you have another question or comment?
I promise I won't say any more.
Oh, you can ask whatever you want. Are you all set?
No, I'm fine. Thank you.
Okay, thank you very much. And that's a good idea. We'll definitely, I'm sure we will talk about it more in our meeting. So, okay, I see Ed. Go ahead, Ed. Just have to unmute if you meant to raise your hand, or maybe you didn't mean to, but your hand is raised. Okay, great.
Oh, no, I did. Thanks, Mike.
Yep.
The general question is, we have an upcoming event with this food truck at the fairgrounds. What's the advisability of old people like me going to that?
And was that event sanctioned by Ledgelight?
It is. And so we've been working with the town and Mike and his staff. Our food service inspectors have reviewed all of their plans to make sure that they're in compliance with DECD sector guidance rules as far as separation distances and participants and so forth. So yes, it has our blessing, and one of our sanitarians, Joe, will be there on site, making sure that they're doing everything they're supposed to be doing. To answer Ed's question, I'll answer it like I answer my mom when she says, "Can I leave the house?" My answer is always yes. Just follow the guidelines and stick to them. And if other people aren't following the guidelines, avoid them at all costs. I still do all of her shopping. It doesn't seem to matter what I say to her. But yeah, it's safe to go. I think as everybody's personal situation is different. If you're immunocompromised, if you have serious health issues, you have to consider the fact that your response to a COVID infection will likely be more severe than someone who is relatively healthy. But I think when we're working with all of these vendors, so to speak, and this is a perfect example, we make sure, working with a town, we make sure that they're doing everything they're supposed to be doing, and that puts our community at the least amount of risk possible. So good question.
Thank you very much. Appreciate that.
Sure.
I see, Nita, did you have another follow-up question? Your hand was up, so you just have to unmute.
Unmuted.
Yep, you're all set. Do you have a question, another question or comment?
No, I'm all set.
Oh, okay. Must have just, we'll lower it. All right. Are there others with questions? We have an open queue and about 7 minutes left. So if there's any other questions, let's see. Oh, I see one on the Facebook page, Steve. At North Stonington's Board of Education meeting, someone stated, I don't know who, that a hybrid versus a full model would make no impact on the rate of infections in any given town. Steve, do you agree with this assessment that a change in attendance model will not impact a community's infection cases? So I think that North Stonington, I don't know what the outcome was. I think they're looking to come back full based on the data we have. So
yeah, I've had numerous conversations with Superintendent Nero on this, on the subject of going back to full in person. I think if a community wanted to go back to full in person, North Stonington is one of the ones that based on the local data, I would be supportive of. I know the town of Old Lyme has been full in person for quite a while, actually since the beginning of the school year. and they've had very minimal issues in their school and in their community. So I do think, although it's going back to what I said earlier, it's really hard to base decisions on very small numbers. We know it's working well in North Stonington now. That's something to remember. The hybrid model is working really, really well. So any move from that is the results, it will be speculation. I'm not sure exactly what would happen. It may be perfectly fine, or we may find that having kids in school all the time, maybe the separation distances can't be met or can't be met as well. I think North Stonington is probably in the enviable position of having a lower amount of students and the availability of enough space to really put distance between the kids. So that's definitely something I'm happy to participate in that conversation. Yeah, a lot of things to consider for sure. And as I mentioned before, if DPH comes out with new metrics, if they're based on town level data over a 2-week period, then absolutely that would be supportive of North Stonington moving to that model. If they stick with the current county level data, then the answer would be, well, you still fall in the category at the county level data of hybrid model being the best. But as I said, the local data I think is more important than any metric that someone puts out. We have to look at what works in the community and the advisability of changing something midstream. And that reminds me of something. Whenever we make a change, it's going to have some type of impact on our communities and our children and our teachers. So we have to be cognizant of the fact that if hybrid's working and we decide to go back or move to a full in-person model, okay, that might work, but what happens if our cases increase? What happens if that wasn't a good move? Then we're moving back again. So that will be disruptive to our school system, to our teachers and parents and students who all make arrangements to make sure that their children can get the best education possible in the midst of a pandemic. So we don't want to jump to conclusions. We want to look at the data for a longer period of time and be confident that if we're moving from one model to another, that we're going to be able to sustain that move.
I know our Board of Ed has been very cautious and thoughtful about the process and been, really trying to figure out the best way to make sure these kids are having a good education, but being safe as well as the teachers. So we commend them for the work that they've done, as well as the teachers and the administration. It's in both schools. I mean, certainly a challenging task for all, public servants and everyone. And as we're kind of coming up on the end here, Danielle, did you have anything else that you wanted to add?
No, just again, thank you so much, Stephen. I can't imagine if you ever sleep, but thank you very much. And thanks again, Mike, for organizing and for everybody for tuning in. And hopefully we'll share this information with others who couldn't participate.
Great. And if anybody in the community has any other questions that you didn't think of, my cell phone number is on every press release that Ledgelight puts out. You can just pull it right off of our website. And I take calls 24/7. So if you think of something, just give me a holler and I'll do my best to answer it.
Great. Well, thank you both for taking the time out of your busy schedules. Thank you for everyone who took the time to listen in. Again, we'll post this to our YouTube. It's on the Facebook, and Ledgelight's always very accessible for other information. So everyone stay safe, wear those masks, and we're going to get through this. So thanks, everybody.
Thanks for having me. Have a great night.